The premier event for infection prevention and control is coming to San Antonio this June. APIC's annual conference brings you the latest research, innovative products, and practical knowledge to help you prevent infection. From inspiring keynotes to thought-provoking panel discussions, APIC 24 curates an extraordinary platform for knowledge exchange. Meet IPs from around the world who face the same daily challenges as you. If you work in infection prevention and control, you don't want to miss this event. Learn more and register to join us in person or virtually at annual.apic.org.
Paul Medical designs, validates, manufactures, and supplies disposable point-of-use water filters for use at hospital outlets such as faucets and showers to act as a barrier to opportunistic waterborne pathogens which may lead to patient infection. Based on studies, using a conservative estimate of only $7,000 per healthcare-associated waterborne infection, the average U.S. neonatal intensive care unit could achieve net savings of approximately $143,862.50 following filter installation. Please visit medical.paul.com to learn more about our point-of-use filter products.
You're listening to the 5-Second Rule, brought to you by APIC, the Association for Professionals in Infection Control and Epidemiology. Together with our nearly 16,000 members, we strive to create a safer world through the prevention of infection. Join us while we talk to infection preventionists and other experts to learn the truth about some common myths related to the risk of infection and to get tips to keep yourself and the people around you safe from infection.
Hey everyone, welcome back to another episode of APIC's The 5-Second Rule. I'm Silvia Quevedo, and today it's all about water. We're going to be talking to Dr. Janice Stout about waterborne pathogens and some important information you need to know about these bacteria and other microbes that can cause devastating disease. Dr. Janice Stout is President and Director of Special Pathogens Laboratory and Research Associate Professor at the University of Pittsburgh, Swanson School of Engineering, and that's in the Department of Civil and Environmental Engineering. She's an infectious disease microbiologist and is recognized worldwide for seminal discoveries and pioneering research in Legionella. She's assisted in developing the first Legionella prevention guideline back in 1993, and she continues to serve as a model for national and global health agencies and organizations. Welcome, Dr. Stout.
Thank you, Sylvia. It's my pleasure to be with you and your members.
Great. Well, listen, we have a lot to talk about today. Here's the thing. I don't know where folks were last year and the year before, back in 2018 and 2019, but many of you may remember that in the news, the New York Times and other media outlets, there were reports of outbreaks of Legionella at like hotels in Atlanta. I believe in North Carolina, it was a hot tub or at a state fair that caused terrible infections for the public. So we're going to talk about some of that today, some of the sort of creepy crawlies that can be found in our water systems that can cause really devastating disease. Dr. Stout, do you remember hearing about some of those outbreaks in like the public?
Yes. And what's really interesting to me after studying Legionella for more than 30 years is that Legionella is sort of a marquee bacteria. It hits the newspapers, gets the headlines, and that's actually a fraction of the number of cases of Legionnaire's disease that occur annually in the United States. But those are the ones that get the headlines.
Okay, so that's a great point. So would we go so far as to say Legionella is like the Kardashian of like waterborne pathogens? It's getting the attention on like media.
Yes, and actually, I think Legionella is a star and deserves its own star on the Hollywood Walk of Fame.
Okay, but there are others. So can you share with our listeners what are some fairly common, and we know there are probably pathogens we haven't even discovered out there, but walk us through some common waterborne pathogens that have led to outbreak and disease.
Well, your infection control practitioners are very familiar with the Center for Medicare and Medicaid Services. And in 2018, they came out with a memo that was about Legionella, but embedded in there was a number of other waterborne pathogens. And everybody was tasked with preventing the spread and growth of these pathogens. And those waterborne pathogens that were called out by CMS were Acinetobacter species, Burkholderia species, Mycobacteria, Pseudomonas aeruginosa, and one of my favorites, just because it's fun to say. Are you ready?
Yep.
Stenotrophomonas multifida. Now, doesn't that kind of have like you want to do a line dance to that?
Say that fast 5 times.
Exactly.
Wow. Okay. So those are just to name a few. And I am also going to call out one that I heard of recently related to reports of outbreaks way back in 2016 at the National Institutes of Health Clinical Center. You might even recall this, where they had I don't know if you would call it rare, but let me get it right. Is it help me with it. Springomonas.
Yes.
Carensis, correct?
Yes.
Sphingomonas carensis. That rolls off the tongue like nobody's business.
Yes.
So there are a lot of different pathogens in water. So talk to us a little bit. I mean, for me, this is fascinating because my understanding is Legionella and some of these other bacteria species that you're talking about, they are naturally occurring in the environment, correct?
Correct.
So what's the tipping point? What makes them dangerous?
So it's really good that you mentioned that they are naturally occurring, and so these bacteria come into our municipal water treatment plants from natural sources like rivers and lakes, and including the soil in those rivers and lakes, and then they come through the pipes to our buildings or hospitals. Most of the time in low numbers, and sometimes even undetectable numbers. It's when 3 factors come together that they become problematic, and this is particularly true with Legionella bacteria. The first is temperature. So they don't multiply at cool temperatures. It's when they get into hot water systems and warmer systems closer to body temperature that they grow and multiply. And then nutrients. And most people don't think of tap water or the water in our hot water systems or in ice machines as having nutrients in there that bacteria can use to grow. But remember, there's sediment or dirt in there. We can't see it, but it's there. So temperature, nutrients, and other microbes. And so this is where it gets a little creepy because now you've got amoeba in there, unicellular organisms, you got other bacteria, and they're helping each other to grow and sort of using a technical term of synergy. They do better together than alone. And so those conditions exist in our building water systems.
So, and by the way, yeah, we love creepy here at the 5-second rule. We've talked in other episodes about biofilm and bioburden. Is that something that we need to discuss here when we're talking about these particular pathogens?
Well, if you think about water on any surface, and imagine the surfaces inside of showers, faucets, ice machines, building water systems have tremendous surface area. Anywhere water is against a surface, the bacteria attach there, and one of the bacteria we talked about, Pseudomonas aeruginosa, is great at producing slime. So now we're getting even creepier. So that slime has a very technical name, but basically all you need to know is that exists anywhere at a water surface interface, and you can just that exists all throughout our water systems and in our healthcare facilities. So they're there. Some of them establish the biofilm. Some of them come along afterwards and just stick there. It's a way for them to capture nutrients as water flows by. So it really is in all of those water systems. So the thing to really focus on when you're thinking about infection prevention is to prevent that exposure of the patient to the water when they are vulnerable or have a line in them, or in the case of Legionella, if they drink it, aspiration is a way of transmission, or aerosols, breathe in the droplets. This is the way that Legionella gets into patients in their lungs. These other waterborne pathogens have multiple modes of transmission, contact, person to person, medication that gets contaminated because of exposure to water. So that's one of the key differences between Legionella and these other waterborne pathogens is Legionella is just the water. So if you control the bacteria in the water, you prevent the infection. With these other waterborne pathogens, there's multiple modes of transmission, so we have to be more vigilant.
Okay, so we talked about there are some factors that create a perfect storm for a healthcare facility or a place like a hotel, or in the case of what was reported in the news about a year and a half ago or 2 years ago, I can't recall, about the hot tub. And by the way, I am sworn off of hot tubs. I'm sorry, hot tub people out there, don't send nasty letters, but I don't know. I've just heard many crazy stories about hot tubs. But here's the thing. You talked about temperature. You talked about nutrients and microbes. I want to focus a little bit on and we're not talking about the home just yet. So I don't want people in their house to freak out. But certainly in a hospital, talk to us a little bit about also water flow. And, I've heard from different plumbing groups about the need to pay attention to water that is stagnant or still. Are they called S pipes? Talk to us a little bit about, what our infection prevention colleagues and even other healthcare workers want to be aware of as far as how water flows.
The issue of stagnant water in our buildings and in our healthcare facilities has recently become a very important issue because of COVID-19 and low occupancy, whether it's a hotel or units on a healthcare facility. And I did this little experiment to demonstrate the concept that you're talking about here. What is the impact of flow or lack of flow when there is no occupancy? So what I did, in infection preventionists will understand this, and this is the reason why you don't take flowers into the room of an immunocompromised person. But I took a vase of flowers, two of them. One, I kept the water flowing in one of them, and the other one I left stagnant. And I want to talk about the ick factor. The one where the flow was going, crystal clear water. The one where there was no flow, it was, talk about murky and slimy and disgusting, but it was a great visual that said, flow matters. And if you don't have flow, it gives those bacteria not only exposure to the nutrients, but also opportunity to grow, because the water also warms up. When that cold water's flowing, there's movement, there's disinfectant in that water, and it stays cool. When there's no flow, cold water warms up, disinfectant disappears. And in the case of hot water systems, that hot water becomes cooler, sort of gets right in the sweet spot for Legionella and waterborne pathogens to grow.
Interesting. So if you're out there and sadly have a friend or loved one who is immunocompromised, don't bring them flowers.
Yeah.
Right?
And I just want to real quick tell you my hot tub story. I was giving a training to professionals in water treatment. And I said, all that you know about how these hot tubs and spas are managed out there, just raise your hand if you would get in one. Guess how many raised their hand?
Oh my God, I don't know.
None. Zero.
Oh,
right.
Wow.
Right. So I went, note to self, I'm going to share that story with everyone.
Yeah, I just, especially after working at APIC, I've just turned a corner on that. We might get some hate mail, but that's okay. We're here to educate and inform. Okay, so a lot happening. I want to go to the subject also of, hospitals. We know that the CDC did create, following, I believe, the CMS ruling on water management systems, some guidance on how facilities can start evaluating their water program. So I want to touch on that. But before I do, we're talking about pretty much all healthcare settings, folks. So not just hospitals, but I recently was at the dentist's office, and they always have that, dentists have water lines that are critical to manage and maintain. So talk to us, Dr. Stout, a little bit more about, the impact of water in a health facility and maybe where does that water come from? I've also heard discussion around the impact that water towers or cooling towers have. I find that fascinating, but also confusing. Do you think you can walk us through that?
Yes, and what Legionella has done is in terms of bringing infection preventionists and hospital engineers together, and they get to learn about each other's worlds. So the hospital facility engineers know all about cooling towers and pipes and cross connections and all of that stuff. And then the infection preventionists know about the infections and the engineers don't. So this is a wonderful opportunity for them to work together to understand the healthcare water systems and how they can transmit infection. And so it wasn't CMS, it was the American Society of American Society of Heating, Refrigerating, and Air Conditioning Engineers, which now goes by the acronym ASHRAE, because that's such a mouthful. And I was on that committee that produced the first United States standard, industry standard for managing Legionella in building water systems. And that was published in 2015. And then CDC came out with the CDC toolkit, sort of helping people to understand what the ASHRAE Standard 188 talked about. So what we really need is infection preventionists and hospital engineers working together because both of them are important. And so the sources of infection are anywhere water is. And so there's numerous examples in the published literature certainly about Legionella in the hot water systems of hospitals. As I said before, transmission is only from the water, so you need to find out if you're in the 50% of healthcare facilities that have Legionella in it or not by testing the water. Cooling towers are those devices up on top of the building. They have nice warm water because they're a heat exchange device, so that's an ideal place for Legionella and other bacteria to grow. Again, you have a water treatment professional that's charged with treating that cooling tower to make sure that Legionella doesn't grow. But what's described in this ASHRAE Standard 188 is how do you know that those risks are under control in your building or your hospital or your long-term care facility or your retirement community or that hotel. And so it described a water management approach in sort of a high-level detail of how to have a water management program, who should be on that team, which in our opinion, 100% should have infection preventionists on that water management team. And actually last year, Silvia, we presented at APIC, and the title was Water Safety and Management Plans, a Patient Safety Initiative that Needs Infection Preventionists. And we said that because over 90% of the people that we were helping with this had engineers on their team, and only about 50% had infection preventionists. And we really felt strongly that infection prevention needs to be on that team.
Yeah, for sure. I think APIC would agree with that. But the challenge often is that many of our members may not be as familiar with all this information. And some of the questions have come up around testing upstream, downstream, midstream, understanding, culturing. Can you touch on that? I know that that's probably a topic that we could have 50 episodes on, but that's a challenge for our members that may not have all their the familiarity with water.
Yes, and that's perfectly understandable. So because I've been in this for so long and I have a pragmatic approach, this is simply what needs to be done in terms of how to sample. So the question is, you're asking, when the patient or user of that fixture steps up and uses that water, are they exposed to Legionella, yes or no? First draw, the immediate hot water that comes out of that tap, turn on the hot water, fill the bottle. And fill the bottle, 250 milliliters is enough to send to the laboratory to do standard culture. Standard culture is the gold standard because it tells you not only is Legionella present, it tells you what kind of Legionella is present, both the genus and the species and the serogroup, and all of that is important in assessing risk. Also gives you a semi-quantitative colony forming units per milliliter. So actually doing the sampling from the fixture is really simple. What we say is a minimum of 10 outlets, a mixture of faucets and showers, sort of roughly representing the water distribution system for Legionella, gives you an idea of how extensive Legionella's presence is in your water system. That's directly correlated with risk. So it's really pretty straightforward and easy to get that information to say, is your facility colonized with Legionella? That means there's risk. If it's not colonized, that means there's no risk of Legionnaire's disease occurring within your facility.
Okay, that sounds pretty straightforward. What about some of those other pathogens you were talking about? The really hard to pronounce ones from the beginning of our show.
Right. Well, so it turns out that each of these pathogens, whether it's Legionella or the other waterborne pathogens like Burkholderia, Stenotrophomonas, Acinetobacter, the media that you would use to culture respiratory flora, a sputum sample from a patient, is different than what you would use to test for these organisms in the environment. And this is a common error that people make. They think they can send that water sample to the clinical laboratory and they'll be able to culture for all of these pathogens because they grow up from patients all the time. Well, that media is designed to inhibit respiratory flora. It doesn't inhibit environmental flora. And so specific media has been designed to inhibit these environmental bacteria to allow us to see, so to speak, whether Stenotrophomonas is there, Acinetobacter, Burkholderia. So it's really important to send those samples to an environmental laboratory because they have specialized media for the isolation of these pathogens.
Wow. Let me ask you another question, Dr. Stout, on this issue of testing and where to look. What about looking at, your sink, the drain? Like I look in my bathroom drain sometimes, it's like that black gook. That highly technical term I just used, gook. Yeah. But there's stuff lurking there, as you indicated. Is there value in that? Looking at, the pipes and the slime, or do you do that after you've determined there's a risk and you have an outbreak?
It's a great question, and I love your highly technical term, black gook, because that's exactly what it looks like, and I have seen it. And it's just chock full of all kinds of microorganisms. And so unlike Legionella, where we've got 30 years of well-documented correlation between the extent of colonization of fixtures and disease risk, it's less clear with some of these other organisms. What we do know, and this is sort of the retrospective, after you've identified the infections, you go looking for the source. That's the model typically for these other waterborne pathogens because they can be fairly prolific and extensive in these ooky drains and such. So for example, there have been Pseudomonas infections that have occurred because of splash from the sink that sort of hit that black guck down there and then splashed it out onto materials that are in contact with the patients. And so the remedy that came from those investigations is to make the sink, the faucet, offset from the drain so it doesn't go straight down into the drain. So that's something in terms of product and the way to select sinks that's really important for infection control, to work with engineering on that. The other in the topic of faucets, sensor faucets, electronic sensor faucets have been shown to have more Pseudomonas and other bacteria, including Legionella, compared to standard two-handle blade type fixtures, where you separately control the hot and you separately control the cold. And so you Yeah, you probably want to put those in public areas, but not in your high-risk areas like ICUs or transplant units.
Very interesting. Who would have thought?
Mm-hmm.
So what would you say to our listeners who are not in healthcare, but maybe at this point freaking out a little bit? Please don't freak out, because we all have kitchens and bathrooms and, pools and, well, I don't have a pool, but people who do have pools. What should we say about how they manage water? I mean, our water comes from our local municipality. We hope that it is being treated properly, but what should the consumer know about water and water safety?
It's a great question, and one that we asked with regard to Legionella early on, because we were finding Legionella in about 50% of these complex buildings, healthcare facilities. So we asked the question, would we find Legionella to the same extent in private homes, residences? And the answer was no. Only about, actually less than 10% of over 200 homes that we tested in the Pittsburgh area had Legionella present. And we actually then did an EPA-sponsored study later asking, do people get Legionnaire's disease from home? And the answer is very, very rarely. And most of the time that was in people with very compromised immune systems. Someone recently diagnosed with leukemia, an elderly woman who had chemotherapy and was using a shower that hadn't been used in a long time. So the risk with regard to Legionella is very, very small. We do get water that's adequately treated, and thank goodness for that. And so the risk really isn't so much in the cold water coming from the municipality, because it has an adequate amount of chlorine to control a lot of these organisms. It's when that water gets into a different environment where, as I said before, it warms up. So when you put it in that hot tub is nice and warm. It's got a lot of organic material in there. You may not be adding enough of the disinfectant to control it. Swimming pools, less so. It's much more larger volume of water. And you don't have to worry about those organisms so much in the home unless you are immunocompromised. And so what I always say is, what would I do? What would Dr. Stout do if she was immunocompromised? There are filters you can put at the point of use, right on the end of the shower or right on the end of the faucet. If you were going through chemotherapy, for example, you would want to restrict your exposure to tap water.
Wow. Gosh, there is so much to talk about with water. Especially in light of recent years and some of the climate issues, multiple hurricanes, flooding. There's really a lot to talk about in terms of how we manage our water, not just in the community, but in healthcare, whether you're a doctor's office, a dentist's office, or a hospital. Dr. Stout, I want to ask you, with everything going on with Legionella, some of these other waterborne pathogens, what's really bugging you about how we're managing or not managing this issue?
Well, we could do a whole episode on that, but I'm going to try to be brief because I do have there are things that bug me, and I love using bug as the term here. So the one thing I really want people to understand is, even though we have the water management and ASHRAE, CMS, all of these organizations working really hard to help people to manage the risk of these pathogens in our water, having a plan is not enough. You have to execute the plan. And there's a lack of knowledge generally. You alluded to it earlier, Silvia. And one of the things that I've been working hard on is to kind of raise the bar in terms of knowledge of Legionella and waterborne pathogens, so that people are better equipped to manage this risk. So I've worked with a couple of organizations to put together a training on Legionella water management, and an organization called the American Society of Sanitary Engineers, ASSE, just put out a new standard 12080, that will certify people's basic knowledge on Legionella and water management. And there's an organization called the International Association of Plumbing and Mechanical Officials, IAPMO, that's doing training for this to certify people on their knowledge. So I encourage people to do that certification training, pass the word on to others in your organization. That training is available now. And I think that will go a long way to making people successful in controlling this. The thing that really bugs me is that people aren't testing their hospital water systems for Legionella. And I think it's because they're afraid of the answer. Well, now we have the tool, the water management plan, so you don't have to be afraid of what the answer will be. And most of the time, the answer is going to be Legionella is not there. So don't put your patients or building occupants or the people in the retirement home at risk of getting Legionnaire's disease. Test to protect them.
Got it. And, we are definitely going to bring you back to APIC to help educate our members, those that are still feeling a little less secure about their water management knowledge and skills. And there may be opportunity in the future to partner. APIC certainly spends a lot of time collaborating with other organizations on how to keep people safe. Any last recommendation for our infection preventionist colleagues on resources? We know we have the CDC water management system, water management guidance tool.
Yes.
Thank you. And we have ASHRAE 188. Anything else you would want to direct our members to that might be a nice resource for them?
Yes, and thank you, Silvia, for the opportunity to add to the discussion and to contribute resources. And one of the things that has me worried or has had me worried is the COVID shutdown. So on our website, specialpathogenslab.com, we have under the COVID resources information about what to do about shutdowns, how to do a disinfection to make sure that when you reopen or reoccupy those spaces, you can do it safely.
Great. Well, you've heard it here. I think we could go on for another 5 episodes, or maybe that's just me because I'm fascinated by all this water talk. I was at a conference where they talked about, well water and city water and the whole Flint, Michigan debacle. And, anyway, maybe it's just me. I think it's fascinating. But I cannot thank you enough, Dr. Stout, for giving us great information on Legionella and other waterborne pathogens. With that, I encourage everyone listening to check out www.apic.org for more information on all things infection prevention and control.
Thank you so much.
Thanks for listening to the 5-Second Rule, produced by the Association for Professionals in Infection Control and Epidemiology staff, including Silvia Quevedo and the APIC Communications Committee, in partnership with Human Factor. Audio tech is Blake Alphin.